I'm Dr. Charles Moak with Allure Medical, and I want to review with you a ThreadLift that we do at Allure Medical. These are using sutures, which is similar to what we use to sew things up when doing things like a tummy tuck or a breast lift or a facelift. And they're called barbed sutures, where they have little cogs on them to lock in the tissues and lift up. They're placed into the support structure of the face. Now, you have your skin, which is obvious, and you have your muscles that move your face around, which may be obvious, but there's a layer in between called the SMAS, S-M-A-S, and it's a tissue that connects the skin to the muscles, and it's kind of thick, and this is what we use when we're modifying the face with a facelift to lift the face when it sags over time. And it's designed to lift and anchor principally the mid and lower face. Now, a facelift can lift the lower face. The ThreadLift can lift both the lower face and the mid face. It's used after Botox and Magic Lift typically. So if somebody has facial deflation or loss of volume, the ThreadLift is not appropriate for them at that time. They could do it along with a Magic Lift or after a Magic Lift, which is Magic Lift is where we refill the loss of volume in your face. It also does not overcome hyperactive muscles, which we use Botox for. And it's to lift difficult to treat areas, which principally is the lower face and right around the mouth, such as the nasolabial fold. It addresses the same area as a facelift. The facelift, we call it a facelift, but it's really a neck and jowl lift. So the facelift does not address the mid-face. That's mostly addressed with fillers. The Magic Lift typically addresses the mid-face, and the sutures can address the nasolabial fold, which the facelift can't. And it's done without surgery. But the results aren't going to be quite as dramatic as surgery, especially with somebody with significant laxity in their face. A surgery would give them a better result. So this is somebody that is going to accept a lesser result if they have significant sagging, and they may do it more than one time to get a better result, or somebody that doesn't have that much sagginess and this needs a more minor treatment. And it's easy to repeat. You can do it again 6 months later to get more better. If one treatment gets you modest improvement, then 2 treatments will get you more improvement. But typically we do it once, although it can be repeated for more significant laxity. So here's a person that's concerned regarding her nasal labial fold. So the arrow points at the nasal labial fold that goes from the corner of the nose to the corner of the mouth. And this is sometimes treated with fillers, which sometimes looks a little weird. I don't like filling that area very much. And it's sometimes addressed with fillers to the mid face. They'll pull it up. That's more natural looking. And this can't be addressed with a facelift, so sometimes we consider threads for this area. The marionette line, which is a line between the mouth and the jowl. This is called marionette after the marionette puppet. And the jowl, you can see her jowl is a little bit saggy there, has a little bit of a droopiness. So when we are doing the thread lift, we want to address the ligaments of the face. So these are called retaining ligaments, and this is called the masseter retaining ligament. It retains the skin to the bone, and if we get past that, we can really anchor the thread so it doesn't slip or lose its grip to the face. And this is called the zygomatic retaining ligament. Again, we want to get above the zygomatic retaining ligament and behind the masseter ligament with the thread so they can anchor the areas we're concerned about, nasolabial fold, marionette line, and jowl, and even neck, to the retaining ligaments of the face. And this is a typical pattern. We would have 2 entry sites, one kind of lateral to the eye and one just behind the masseter retaining ligament. And both these are designed to be past the ligaments. You're given a little anesthetic with lidocaine, and they poke a little hole in the skin with a needle. And the cannula carries a suture in. The cannula is a little metal, kind of like a needle, but it's dull at the end, and it slides through your tissues where the provider can pass it through the SMAS layer of the tissues, go all the way past the area of concern, in this case the nasolabial fold, the marionette line, the jowls, and even the neck. And there's little cogs on this thread that grip the tissues, and then we can pull it back or massage the tissue onto the thread, and the anchor ligament keeps it in place. So here's an area of concern. You see these pictures are 2 months apart, somebody who had a thread lift done, and she doesn't have loss of volume. She's already had, fillers and Botox where appropriate. In the nasolabial fold is a top arrow. That's called the nasolabial fold. The middle area is called the marionette line, and the lower area is a jowl. And also we can see that we would be treating the neck. So in this case, you can see her nasolabial fold is softer. The marionette lines is softer and almost gone. The jowl has a nice pretty contour, and you cannot see it very well, but you look underneath her chin on the left picture, you see a little bulge of skin laxity, and the picture on the right is pretty much tightened up by doing a thread into her neck. So the ThreadLift has sutures which are replaced with your own tissue over about 6 months. 2 to 6 months they break down and your own collagen replaces it, so there's a permanent result to it. And the results are long lasting. There's probably some degree of permanence, but it's not like you stopped aging. So if the ThreadLift makes you look 2 or 3 years younger, you might want to do it again in 2 or 3 months to maintain that appearance, that youthful appearance. Minimal downtime. And there's things such as bruising and swelling and even skin dimpling that can occur, but it goes away in time. Typically, there's very little downtime. If people have a little soreness to their face, especially when they're moving their facial structures and facial muscles, but that goes away pretty quickly.